At Altera Digital Health, we help our clients solve complex problems, and we measure our success by their outcomes. Altera Health is a global healthcare IT company providing EHRs and digital solutions that improve clinical, operational, and financial outcomes for healthcare organizations. So the biggest way that EHRs are still affecting clinical workflow, they were initially rooted in regulatory, in billing, in record keeping, and that DNA persists today, which has a big impact on clinical workflow. So it's a big contributor to clinician burnout and to workflow fragmentation. So when I am a physician and I'm logging into the EHR to see a patient, I spend a lot of time trying to aggregate the data into a meaningful patient picture. I only have so much mental energy to spend, and I spend a lot of that digging through the EHR versus spending that interaction time with the patient. AI is going to have a large impact on healthcare organizations. We're starting to see that today, both in healthcare organizations and in EHRs. And starting with ambient voice is the biggest thing that we've seen at the trade shows over the last couple years. It's a big focus for EHRs in terms of streamlining documentation and help making documentation just a byproduct of just the natural interaction between the clinician and the patient. The question that healthcare organizations should ask their EHR vendors when they're in an RFP process seeking a new vendor partner that they wouldn't have had to ask 5 years ago is, what is your AI strategy, specifically around generative AI? Also, what guardrails do you have in place to ensure data integrity and safety? So I would say the one thing that Altera Digital Health offers that differentiates us against other vendors is our flexibility. We have our best practices when it comes to EHR development and implementation, but we really do offer a partnership with our clients in terms of tailoring the EHR to meet their individual needs.